Goodstein and Lanyon in 1975 defined personality as those enduring characteristics of the person that are significant for interpersonal behavior. In other words, our dispositions or our ongoing characteristics that are noticeable throughout our lives. When we measure personality, the more modern approach to personality is to look at dimensions. And what's interesting in the DSM is that it does not yet take account of dimensions. So probably in the future, this dimensional approach will be incorporated in the DSM. Let's look at the Big Five. You've probably already heard of the Big Five by Costas and McCrae to describe personality. There are 5 major traits. We have conscientiousness, openness to experience, extroversion, agreeableness, and neuroticism. The DSM, of course, does not use a dimensional approach. Instead, it uses a categorical approach. Personality disorders are defined as an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture and are manifested in 2 or more of his or her areas of mental life. In their cognition, what they think, in their affectivity, what they feel, in interpersonal functioning, how they behave with other people, or impulse control. Let's define now inner experience and behavior, these 4 areas. Cognition, the way the person sees and interprets the self in the world. Emotional response, whether the person can experience the full range of emotions and moderate their intensity, changeability, and appropriateness to the situation. Interpersonal functioning, how the person gets on with others. And impulse control. High impulsivity is often seen in personality disorders. So looking over personality disorders and what's important in the patterns that people express, they have to be enduring. We will see them beginning in childhood, continuing in adolescence, and very prominent through their 20s, 30s, and 40s and on. So they have to be patterns across the life stages. They must deviate from expectations. In general, it has to be pervasive and inflexible. But for people that have a true disorder, it is pervasive and inflexible. They never behave in a different way. Sometimes I like to give the example of jealousy. It's very normal to be occasionally jealous. So we all experience it at some time. But if somebody is jealous all the time, then they may have antisocial personality disorder. They may in fact try to control their spouse because they cannot not experience jealousy. It's at a high degree all the time. Again, there's onset in adolescence and early adulthood. There's now a lot of research and exploration looking at personality disorders in children. They may not be the same personality disorders that we see in adulthood, but there's definitely a lot of research and interest in this area because it is not well documented or treated in the DSM. So that's an area for future research. It must lead to distress and impairment, and it has to be flexible and maladaptive and cause functional impairment. In fact, not everyone who might have a personality disorder is diagnosed in a clinic. And these researchers, Cotreau and Blackburn, Debray and Nollet, have found that between 2% and 13% of people in the general population likely have a type of personality disorder. In fact, it may not be the personality disorders that are listed in the DSM, but they may in fact have inflexible patterns in their personalities that makes it hard for them to really fit in or get along. There's a much higher rate of personality disorders in patients who are treated for psychiatric problems. So people who have a personality disorder and then have some other kind of clinical problem, for example, may be seen for psychiatric treatment. And that's usually between 30 to 50% of any psychiatric population. There will be a diagnosis on axis 2. They will seem to be having a personality disorder. There are 10 personality disorders currently found in the DSM. They're grouped into 3 clusters. In Canada, we often say the odd, the mad, and the sad. Let's look at cluster A, the odd. Odd or eccentric disorders. This includes people, like the people I've just talked about, paranoid personality disorder. Others who are schizoid or schizotypal. Let's start with paranoid. People who have paranoid personality disorder, of course, suspect that somebody's out to get them. They just suspect the worst all the time. They think others don't like them. And their paranoia is to the point where others just stop having relations with them because they don't feel trusted or liked. The next personality disorder is schizoid. People who have schizoid personality disorder are loners of some type. Loners meaning they like to stay by themselves. They're often absorbed with their own feelings and are fearful of closeness and intimacy with others. They're given to daydreaming, and they fantasize a lot. There's a difference between the people who are loners, who are schizoid, and the people who are loners, who are schizotypal. When people are schizotypal, they have slightly odd thoughts. And so in other words, they stay away from other people because although they don't have hallucinations and delusions, they have types of thinking that are close to psychotic. I, for example, knew a child who in adolescence spent her time avoiding other people at the college or the junior high school she was at. Instead, she thought she was a unicorn. She imagined she was a unicorn. And she would only talk to other people who would pretend to be unicorns with her and who would join in her magical thinking. On the other hand, the schizoid person, who is also alone, doesn't have many feelings. There's something atypical about their emotions. They, in fact, don't feel really happy and don't feel really sad. So that's really odd and eccentric. And of course, these cluster A disorders are vaguely related to schizophrenia, meaning there may be some underlying neurological base that produces these types of symptoms. But none of these personality disorders are necessarily going to lead to full-blown schizophrenia. People are just odd or eccentric. Moving on, let's look at cluster B, the MAD disorders, also called dramatic, emotional, or erratic. In general, more men than women have antisocial personality disorder. And in fact, you may have heard the words sociopathic or psychopathic. These are older words from the early part of the 20th century, which we don't use as much anymore. People use these words more in sociology. Instead, we use, as psychologists, antisocial personality disorder. People who have this have no respect for the dignity of others. They, in fact, harm animals, people. They may lie. They are totally untrustworthy. So often you can't form an attachment to them because they simply will move on and use you. So their antisocial acts may end up in extreme cases as violent aggression, sometimes murder, sometimes sexual assault. The female version of antisocial, it's often been said, is borderline personality disorder. Notice that antisocial personality disorder means acting out the most aggressive part of the male social role. So men are expected to be fearless soldiers, let's say. So if you're really aggressive, then, and the worst part of aggressive, you're antisocial. Women are supposed to express their emotions, take care of other people, be loved and feel love. Well, women that have borderline personality disorder, and there are more women than men, although there are some men, are often people who never feel secure in their attachments. This may mean that they cling to their partners, they feel unloved most of the time, so they try to fill this emptiness up by getting other people to validate them. Histrionic personality disorder is buried in old Freudian theory, but in generally, it now refers to somebody who has exaggerated emotional expression and who really needs reassurance. They may need reassurance that they are beautiful, that they're important, that they exist. It's a little bit like borderline, except that there are no suicidal symptoms. Narcissistic personality disorder refers to people who have a clear sense of, I am wonderful, you are not. In other words, they're often people who lead a cult. People who think that what they need and want counts more than what other people need and want. Cluster C are the sad people, odd, mad, and sad. They're anxious or fearful. So, for example, the first sad cluster C behavior is avoidant personality disorder. These people avoid others because they're very sensitive to rejection. They're afraid they won't be loved. They're afraid they could get hurt if they circulate and don't get accepted in the world. Notice that both avoidant and schizoid are two personality disorders where people avoid other human beings. The avoidant personality has a different reason for not going along with others, not for low interpersonal interaction. They're afraid to be hurt, whereas the schizoid personality doesn't feel anything, so there's no motivation to find friends. They like being alone because they don't feel anything when they're with other people. The avoidant people feel too much, and they feel hurt more easily than others, so they learn to avoid hanging around with other people. Next, we have dependent personality disorders. Often these are people who've been very protected as young people or children. They may be shy to begin with as babies. Their parents may treat them very carefully, and eventually they do not learn to make their own decisions and take care of themselves in their own lives. And finally, we have obsessive compulsive personality disorder. These people are not necessarily sad. They have a particularly organic type of obsessive compulsive of anxiety disorder or personality. Obsessive compulsive people tend to have a lot of rituals. They tend to be people who are perfectionists. But I think overall the general consensus is future versions of the DSM will not have 10 categories or 12 categories. Instead, they'll just be dimensions. We'll be able to give people personality inventories or questionnaires like the 5-factor inventory to determine a personal profile for each person. Thank you for listening.